This is the procedure for the 6-month tubing change. Outpatients have their tubing change done every 6 months in HPDU, the Home Peritoneal Dialysis Unit. However, if a patient is admitted to the hospital, HPDU will notify the RN on the unit that a patient tubing change is due. These are the supplies needed for this procedure: sterile gloves, sterile dressing tray, 4x4 gauze, a small wide catheter clamp, a mini cap, transfer set, 2% chlorhexidine solution, and a mask for yourself and your patient. Clean gloves. Remember that proper hand washing is required for this sterile technique. Here's a tip. The titanium connection after 6 months can become very difficult to disconnect. Before setting up your sterile field, make a quick check. Add a clamp. Do not disconnect. Just loosen and retighten before starting your procedures. Start the procedure by donning your mask and ensure the patient is also masked. Conduct proper hand washing. Then you'll open your sterile gloves using the wrapper as its own sterile field, and prepare your sterile dressing tray with your gauze, chlorhexidine solution, white catheter clamp, and prepare your new transfer set on your sterile dressing tray. Close the twist clamp. Remove the clear temporary cap and replace it with the mini cap. Start by taking your chlorhexidine soaked gauze, open it up lengthwise, and ensure that your gauze is not soggy. Using a 2x2 sterile gauze, hold your catheter and lift it away from the skin. Place the chlorhexidine soaked gauze from the connection point to the titanium adapter. Leave the gauze on for at least 1.5 minutes. Then repeat again with a new piece of chlorhexidine. To discard it, you'll shimmy the chlorhexidine soaked gauze to the exit site point. Ensure that this process is done for a total of 3 minutes. Next, you'll take a dry gauze and wipe the catheter clean. Next, you'll take your white catheter clamp and secure it below the titanium connection. Note, a sterile gauze was used for this procedure. Taking another dry gauze, you remove the transfer set, then discard the tubing. Soak the titanium catheter for at least 3 minutes. You may use your sterile dressing tray and place it in the chlorhexidine solution. Next, you will dry very well and ensure that the excess chlorhexidine is removed. You can ensure that the chlorhexidine is removed from the internal aspect of the catheter by tapping the catheter into the gauze. Attach the new transfer set. Ensure that the clamp locking device is closed. And remove the temporary white catheter clamp. Perform your exit site dressing change. Clean up your dressing tray. Document, and your procedure is now complete.